ask a follow-up question to Mr. Thompson's and your comments about the Second Amendment? You're going to dodge me again?
People haven't had a chance to ask questions. You've asked a lot of
You didn't even answer my question. I submitted it and you didn't ask it.
Yes, ma'am.
Hi, thank you. I know most people don't know that we're getting small cell towers in front of our houses. Thousand Oaks, Simi Valley, they're saying 9,600 in front of, well, in all the communities. So I haven't heard a lot about it here, and I'm just concerned about that military-grade weapon that's in front of our homes, and how you feel about it, and if you'll work with Congressman Julia Brownlee, even at another town hall, just to educate how to protect this, and if you can put a moratorium even temporarily.
So,
Bigger issues, I know.
so in terms of the cell towers that are being installed, you're talking about the 5G
Yes.
networks. So I have signed on to a piece of legislation that ensures that local control happens with 5G, the implementation of 5G. So this is something that is, it's a huge change in how our society is going to be functioning. It's going to, all of our lives are going to be affected by it as we transition to 5G across the world. And we need to make sure that includes conversations around national security, that makes sure that we're having conversations about how it impacts people right here in their day-to-day lives.
Yep.
And the local influence is absolutely critical. So we've been in contact with the city of Santa Clarita, with all the cities that are in our within our district, to make sure that we're in partnership with them and are supporting legislation that provides that ability to implement on a local level. But yes, partnering with our surrounding members to discuss that further as it moves closer is something that I'll definitely want to consider. Yes, sir.
Good morning, Katie, and good morning, everybody. As the discussion is so civil, so good morning is appropriate. My name is Dr. Akash Ahuja, and good to see you again. Good to see you, Jonathan. I'm a psychiatrist by profession and live in the community. Are there any initiatives you guys plan to take or are in the process of taking in DC to expand the mental health coverage for the people? As some of us are well aware that mental health costs this country a lot of resources, a lot of money. When all good people like us are not able to work, are not able to work because of the mental health issues, it's not only cost the community, it costs the human beings, it costs the individual so much, and then that also relates to the problem which the person mentioned there of the homelessness.
Yes.
Kind of interrelated.
Yep.
So is there something which you guys are thinking about?
Yes, absolutely, and that's actually a legislative priority for me personally that we're looking into different options around. But the mental health issue is one that has gotten really tremendous over the last several years, and it's hard to know how much is, and you might be able to speak to this better than I am, how much of it is an increase in awareness and destigmatization that higher diagnoses, or if it's actual increased prevalence. But what we know is that people who are graduating high school, 1 in 4 are going to be diagnosed with a serious mental health condition of some kind before they graduate high school. So it's a huge problem, and it is affecting so many different aspects of people's lives, and it's a healthcare issue. So we need to be really actively destigmatizing around it. The suicide rates are things that we're desperately faced with, and we see that every single day. That's something that affects our community personally, and that is really heavily impacting the veteran population.
Yes.
So we're looking at
right.
specific bills around that, around addressing veteran suicides and veterans' mental health. But independently of that, we're looking at how we can expand that access to mental health services for communities that, for example, don't have that. Expanding the workforce as well. We have major shortages of social workers, of LMFTs, of psychiatrists. Just yesterday I was visiting community clinics that said that they have for a year been trying to find a psychiatrist that is, and over and over they have somebody, they think they've almost got it, and it's a battle over pay, over what people are willing to do, and it's really difficult. I mean, there are major shortages, and when we look at the professions that we need to be investing in, I believe that mental health is one of the top ones, because we can prevent violence, we can prevent so many of the issues that can turn into more serious economic factors like homelessness if we don't deal with them early. And what we do know is that the earlier you address a mental health condition, the much better the outcomes are, especially if you can diagnose it and treat it, even while somebody is in adolescence. So those are specific pieces of legislation that I'm in my office considering ones that have been introduced in the past, but what can we do differently this time, and then also what we can independently introduce. And my office would love your feedback on things that can make a big difference.
I have to add that your knowledge about mental health, not being a mental health provider, is very impressive.
You touched on it very nicely. And again, if some of the patients who are waiting for a year or so, if I can see them, I will not charge money. I promise.
Oh my gosh.
Do you treat Trump derangement syndrome? Wonder if you...
Well, I know that we're over time, and I want to thank you all so
All right.
much for being here.
You're not going to give me a
I'm
chance
happy
to
to talk
respond?
to you
You're not going to give me a
afterwards.
chance? Everyone should hear what I have to say, because you
Okay.
both
Well,
brought
if
it
anyone
up.
wants to stay,
Why would you not let your
Thank
own
you all so
So
much.
you're going to not allow